So today we're going to talk about one of the most commonly used HIV medication, also known as TLE. We will explore what it is, how it works, and why it plays a key role in HIV treatment. And just in case if you're wondering why should you listen to me, well, I have been a pharmacist for 17 years and 14 years of that has been within HIV medicine. I have worked at 4 major HIV centers in London in the United Kingdom. I've spoken to thousands of HIV patients. I've learned loads, but more importantly, I'm at a phase in my life where I just want to give back. So TLE is a once daily pill to treat HIV. In that one tablet, you have 3 drugs: tenofovir, disoproxil fumarate, lamivudine, and efavirenz. In the market, it comes under different brands. So for Mylan brand, it comes under Tellura. For Cipla brand, it comes under Trioday. And for MCure brand, it comes under One-A-Day. The way to take TLE is you take 1 tablet once a day, more or less same time every day. So basically have a pill taking time in your head and you try and keep it as close to that time as possible. Saying that, couple of hours here and there is not the end of the world as long as you take your tablets daily. TLE works best if you take it on an empty stomach or keep a gap of at least 2 hours between eating and taking the tablet. If you vomit within 1 hour of taking your TLE tablet, you take the tablet again. However, if you vomit after 1 hour of taking your TLE tablet, that's when you don't repeat the dose. Okay? Another thing to follow with TLE is you swallow the tablet whole with water. You do not chew or you do not crush the tablet, just swallow whole with water. And for any reason, if you ever get admitted into hospital, it's always a good practice to take some supply of your TLE tablets to the hospital so that you can continue taking your TLE tablets whilst you are admitted in the hospital. Now, if you would ask me what is the best time to take TLE, I would say take it in the evening or at night time. And the reason for that is TLE contains a drug called efavirenz, and it can cause dizziness, drowsiness, or vivid dream in some patients. So if you take it at night, it may help reduce the incidence of these side effects. So you can just take and go to sleep. And like I said, make sure you take it more or less same time every day. Now let's just say one day you completely forget to take your tablet. Well, if you remember, within 12 hours of your pill taking time, you take the tablet, okay? But if you remember after 12 hours of your usual pill taking time, then you skip the dose, you wait for your next dose, and you take it as usual, just 1 tablet. The important message here is to not take 2 doses the following day to try and make up for the lost one, because that does not give you any additional benefit. If anything, it can give you more side effects. Just like any other medication, TLE also comes with some side effects. Now on the screen, I have listed the most commonly occurring side effects, but if you want to know the full list of the side effects, you can read the manufacturer's patient's information leaflet. Now, side effects are your body's way of saying that it's adjusting to the medication. They are mostly prevalent within the first 2 to 4 weeks of you starting the treatment, and most side effects do die down once your body gets used to it. And for all you know, nothing might happen to you. So some of the common side effects are dizziness, so you might feel a bit drowsy after taking the tablet. You may get headache, nausea, and if nausea is too bad, sometimes it can lead to vomiting. It can cause poor sleep. Vivid dreams, your dreams will appear slightly more real, as if you're living them. It may give you diarrhea, it can affect your mood, and it can cause tiredness as well. So the key message here is to not stop taking your tablets just because of side effects. And if there are any side effects that are messing up with your day-to-day personal or professional life, you go to your clinic and you talk to the doctor, but don't stop taking your tablets just because of side effects. Now, just like any other medication, the drugs that are in TLE can cause drug interactions, which means that it can interfere with other drugs that you're taking. Now, the total list of the drugs that it can interact with is quite big. So again, if you want to know the full list, read the manufacturer's leaflet. But here I have listed some common ones. So for instance, if you're taking contraceptives or birth controls, TLE can reduce the amount of contraceptives in your body, making it less effective. So your clinic or your doctor will help you choose the right method of contraception for you. TLE can also lower the amount of statins. These are cholesterol lowering drugs in your blood. So the dose of statin may need changing depending on how you respond. Other common interactions include some antifungals like fluconazole, antiplatelet drugs like clopidogrel, some antibiotics like rifampicin, and anticoagulants like rivaroxaban can get affected by TLE as well. So the important thing to remember is that if you start any other new medication whilst you're taking TLE, it is very important to check with your doctor or your pharmacist that they are both okay to take and they're not going to interfere with each other. Now, I've compiled a list of common questions that patients have asked me over the years about TLE, so I'm going to answer them, hoping that it might be of benefit to you as well. The first question is, do I need to take the tablet every day? The short answer is yes. It's not just for TLE, it's for any drug that you take for HIV. For it to be effective, you need to have certain level of the drug in your body at all times, and it only happens if you take it every day and more or less same time every day. Another common question is, will my body get used to it and stop responding? Well, that does not happen with TLE. If you continue to take the tablets the way we tell you to, I can guarantee you that it is going to stay effective in keeping the HIV virus suppressed. Can I take TLE in the morning? Now, the reason why we say take your tablets in the evening is because TLE can sometimes cause dizziness and drowsiness or very vivid dreams as a side effect. So what we suggest is take it in the evening and then you go to sleep, and that just reduces the severity of the side effects because you're going to sleep through most of the side effects. However, if your body is already used to taking TLE and you have been taking it for a while and it's not giving you any of these side effects, and you prefer to take it in the morning because that is a time when you remember to take your tablets, well then that's fine. Or sometimes what happens is people do night shifts, so they have to stay awake at night time and then they sleep in the morning. Even then it's fine to take it in the morning. So the answer to this is you decide what works best for you. But generally speaking, if you're working during the day and you're sleeping at night time, that's when we say take it at night. What happens if I stop suddenly? Well, I personally would not advise you to stop your treatment suddenly because TLE only works if there is a steady amount of all three drugs in your body. If you stop taking your tablets, what happens is the level of the drug slowly starts to drop and virus may start to replicate. And the virus that replicates in the presence of low level of these drugs can become resistant to this treatment. So let's just say you restart taking your tablets, well, there is no guarantee that the treatment is going to work and the virus is going to come back to the suppressive levels. So please do not stop suddenly, and if you feel like you need to stop, make sure before you do, you speak to the doctor first. Does it interfere with fasting? The short answer to that is no. TLE works better if you take it on an empty stomach anyways, so it might work in your favor when you're fasting. However, if you're fasting for religious reasons, like Ramadan, for instance, well, during that month, it's okay for you to change the timing and take it during the iftar or when you're breaking the fast to make sure that you're still continuing to taking your tablets. And after Ramadan, you can then go back to taking tablets your usual time. Can I drive whilst taking TLE? Well, yes, you can drive with TLE, but there is an important caveat. One of the drugs in TLE is called efavirenz, and like I've mentioned before, it can cause dizziness and drowsiness and sometimes trouble concentrating. And this happens especially in the first few weeks of the treatment once the body is getting adjusted to the drug. So if you're experiencing any of these side effects, it is best not to drive or operate any heavy machinery until you know how this medication affects you. Once your body adjusts to it, and if you're not feeling any of those side effects, then it is generally considered safe to drive. That's it for today, guys. Thank you very much for listening. Let me know in the comments what did you think of it, if you're taking TLE, or if you have any questions that I haven't answered that you would like me to answer. I do read the comments and I do reply to them whenever I can. And also, whilst you're at it, please make sure you like, share and subscribe to my channel. It helps this channel grow and reach wider audience. And before you go, just a quick but important reminder. This video here is to help you understand your treatment better, but it is not a replacement for advice from your doctor or your HIV team. Your doctor knows your case better. They have your blood tests and they know your overall health history, and that is the most important guidance to follow. Please do not make any changes to your medication based on anything you've heard in this video, and always speak to your doctor first. Stay informed, stay empowered, and I'll see you in the next one. Stay safe, folks.